In one sense, every child is exceptional. No two children are exactly alike in their ways of learning and behaving, in their activities and their preferences, in their skills and motivations. All students should benefit from programs uniquely tailored to their individual needs. However, schools cannot practically meet the precise needs of every student. For the sake of efficiency, students are grouped into classes and given common instructional experiences designed to provide the greatest benefit to the largest number at a moderate cost. This system works reasonably well for the great majority of students. However, some students do not fit easily into this mold. Some students have sensory or physical disabilities, such as hearing or vision loss, or orthopedic disabilities, that restrict their ability to participate in the general education classroom program without special assistance. Other students have intellectual disabilities, emotional or behavioral disorders, or learning disabilities that make it difficult for them to learn in a general education classroom without assistance. Finally, some students have such outstanding talents that the general education classroom teacher finds it difficult to meet their unique needs without help. To receive special education services, a student must have one or a few designated categories of disabilities or disorders. These general labels, such as specific learning disabilities, intellectual disabilities, and orthopedic impairments, cover a wide variety of problems. Labels tend to stick, and labels themselves can become handicaps for the student. Education professionals must avoid using labels in a way that unintentionally stigmatizes students, dehumanizes them, segregates them socially from their peers, or encourages discrimination against them in any form. The term learners with exceptionalities may be used to describe any individuals whose physical, mental, or behavioral performance is so different from the norm, either higher or lower, that additional services are required to meet their needs. The term disability and handicap are not interchangeable. A disability is a functional limitation a person has that interferes with the person's physical or cognitive ability. A handicap is a condition imposed on a person with disabilities by society and the physical environment, or the person's attitude. For example, a student who uses a wheelchair is handicapped by a lack of access ramps. It is important to ensure that our language and the choice of vocabulary and terminology in referring to people with disabilities convey the appropriate message of respect. There are two basic principles to keep in mind. The first is to put people first. An example of this would be to refer to Frankie as a student with a learning disability, not as a learning disabled child. He is a student first. The first fact that he has a learning disability is secondary. The second principle is to avoid making the person equal to the disability. So again, learners with exceptionalities are students who have special education needs in relation to societal or school norms. An inability to perform appropriate academic tasks for any reason inherent in the learner makes the learner exceptional. A handicap is a condition or barrier imposed by the environment or the self. A disability is a functional limitation that interferes with the person's mental, physical, or sensory abilities. The often arbitrary classification systems for learners with exceptionalities are widely debated, and the use of labels may lead to inappropriate treatment or damage students' self-concepts. About 13% of students ages 3 to 21 in the United States receive special education services. Examples of learners with exceptionalities are students with intellectual disabilities, specific learning disabilities, speech or language disorders, emotional and behavioral disorders, autism spectrum disorders, and vision or hearing loss. Students who are gifted and talented are also regarded as exceptional and may be eligible for special, accelerated, or enrichment programs. Clearly defining learners with exceptionalities and accommodating instruction to meet their needs are continuing challenges.